The kidneys perform vital life-maintaining functions in the human body, acting as important parts of the urinary system. Found at each side of the spine, each kidney monitors and regulates body fluid, excreting them when there is an excess and retaining only the necessary substances. In order to keep the body healthy and filter the entire blood supply, the kidneys produce and release a variety of chemicals, including erythropoietin, a hormone that controls the creation of red blood cells by the bone marrow. Kidney disease currently ranks as the seventh leading cause of death among Filipinos. More than 20% of Filipino patients regularly go through dialysis, and others are on the waitlist for a kidney transplant. Only roughly 400 of these Filipinos have the opportunity to successfully undergo kidney transplantation every year. At Asian Hospital and Medical Center, CKD ranks among other major illnesses like heart attack and stroke. In 2018, CKD patients who undergo hemodialysis rose to 293 versus 225 patients in 2017.
I am Dr. Lynn Almasan Gomez. Presently, I'm the Chief of the Section of Nephrology here at Asian Hospital and Medical Center. Chronic kidney disease is a condition wherein the kidneys have already started failing. There are 5 stages of chronic kidney disease. Stage 1 is the most benign, and stage 5 is the stage wherein you are preparing your patient for renal replacement therapy. Chronic kidney disease usually affects the age population, which is 45 to 65, and there is really no gender predisposition. So stage 1 and 2 will be usually asymptomatic. It is usually in stage 3, 50% of the kidney function is already lost. And that is the stage where symptoms already starts appearing, such as anemia and worsening of hypertension. It can also have some form of vascular bone disease like calcium and phosphorus abnormality. And sometimes also you can get into complications like frequent infection because your immune system is already down. And usually, what you will feel is because of the presence of anemia, so weakness. You are pale looking. Also, you can have some sleep disturbances, and also you can have some loss of appetite, but generally you are weak. It is also sometimes noticed that you can have edema, manas. A high salt, high protein is not good for kidney patients. So we advise them to decrease their salt intake and their protein intake. When they are already in CKD 4 and going to 5, then we advise them to prepare for some form of renal replacement therapy. So renal replacement therapy are 3. It can be hemodialysis, peritoneal dialysis, or kidney transplantation. And of course, the best is kidney transplantation. So hemodialysis is one of the forms of renal replacement therapy wherein we try to take the part of the kidney which is the excretory part. The procedure itself will be the one that will excrete the byproducts of metabolism of protein and all the rest that are not able to be excreted because of kidney failure. We need 4 hours at the least because you're trying to clean 6 liters of body fluid. Hemodialysis will only do the excretory part, no? The other parts, which is the endocrine part, you need to give medicines, you need to adjust it based on monitoring, and this will not be done by the machine. However, the most important function of the kidney, which is to excrete waste, will be done by the dialysis session. Why is hemodialysis apparently the choice? It is readily available. It is not as expensive, and the logistics is you go to a center, whereas in peritoneal dialysis, you are responsible for your own dialysis. Newer dialysis machine that has been arriving, has been developed. All this technology regarding keying in or fine-tuning your delivery of treatment, all this has improved the health of our patients. A system wherein there is really personnel who are always there, and systems that are in place to be able to answer to all the needs of patients, then that will be an ideal environment. No? So to be able to have that particular scenario, you need a good water system, you need a team, a dedicated sets of nurses, you need a technician who will be able to understand how your machine is functioning. Also, the water treatment is very important. Multidisciplinary in terms of the nephrologist as the head of the team, and also the dialysis nurses. All of these are important when you are managing chronic illness.
So it so happened, kailangan daw magpa-check up. So nagpunta kami Dr. Carilisan. So na-find out na parang candidate for dialysis na nag-collapse yung pala, yung sugar niya, bumagsak na. So yung kidney niya is kailangan na mag-dialysis dahil failure na yung kidney. So yun yung start kahit napunta dito. Maganda naman yung experience namin. Yung nurse dito is service nice. So kaya siguro tumagal din 7 years.
Hindi ka nenervyusin eh. Cool. Tapos sabi niya, basta sundin mo lang yung gamot na binibigay ko. Every time na meron ako kailangan, ito tinatawagan niya. Sumasagot mo. More power for the Asian hospital, and hope all the patient will be happy also, like we are, and enjoy life as it is.
To be a complete kidney center, you have to have all the modalities of renal replacement therapy. You have to have prevention, you have to have a chronic kidney disease center, you have to have peritoneal dialysis, and of course, kidney transplantation. Even Asian Hospital will soon be involved in kidney transplantation. The section of nephrology, also the dialysis unit, whether hemodialysis or peritoneal dialysis, we are aware of the burden of kidney disease in our country. It is on the rise because the two causes, which are diabetes and hypertension, is on the rise. And the other thing that is feeding these two population is obesity. These are related to our lifestyle, and therefore we have to be aware of it. We invite you to visit our dialysis center and also ultimately to visit our kidney center here at Asian Hospital.
Asian Hospital and Medical Center continuously aims for high-quality healthcare services innovations, not just to improve health services, but to also widen its scope through healthcare events worldwide. This provides awareness and wider knowledge amongst people. During March and June, Asian Hospital celebrates World Kidney Day and National Kidney Month. Asian Hospital offers blood pressure screening and sugar tests for lay farm participants during these events. People often go to medical institutions for checkups if they get serious symptoms, which indicates serious complications. Early detection is the best prevention. Get screened now!